There we go. So you might have to answer okay to that on your screens, everyone. But let me go ahead and share my first screen. Okay. So every time we do a recording, there is a disclaimer that I have to read. You'll see it popped up here. So content recorded with point click care is valid only as the date the recording is made. Information or instructions about any given topic may subsequently change. Content may include protected health information, which in our scenarios, everybody, there will be no PHI information since we're going to be using a training database. But all content is to be treated as private and confidential. Recordings are managed by the requester, and Point Click Care recommends that files be stored in a secure location with controlled access. So, as I said, my name is Rick Durbin. I've been an end user with Point Click Care since 2003. I came to work with Point Click Care in 2019. So, that's a lot of experience with the system, everybody. I was everything from a business office manager up to a regional, and actually one company trained all their new staff when they came into the company actually how to use the point click care system. So I kind of fell in love with the system. Once you understand that, I found it very user friendly. So jumped at the chance to come work for the software that I had used for 16 years prior to joining their team. Today, we're going to start off with what we call managing security. So we're going to show anyone that has that appropriate security access on how to go in and add a new user. And then most importantly, attach the appropriate security roles, which we will talk about the default ones that come in there today, but as well as your ability to make custom roles as needed in case somebody needs a little bit more access, a little bit less access based off of maybe their position. So we'll go ahead and walk through all of those steps. Beginning, we're going to do a little bit of configuration first. So we're going to talk about, how you log into the database. Again, last week, that was either Thursday or Friday, the clinical consultant sent out your log information related to your training database, your train PCC number 3 database. And then I'll show you some of the default, excuse me, everybody, positions that are already in there, and that'll be the login information for the ones that are currently there. And again, for whoever would be adding security users, can actually build ones to test that functionality out in your training database too, if you need more. So I'll show you how to log in. Then we're going to hit the management console. So you'll hear it called management console. You'll hear it called EMC for enterprise management console as well, everybody. To do a little bit of configuration regarding some pick list items, departments, and staff positions. The databases always come preloaded with certain items, but every client is slightly different. They may, use a different term for a department, or maybe have a department that's not listed there. So I'll show you how to add those in today, as well as possibly a new staff position. And then we'll go through at the facility level. So we'll leave management console for a brief period of time, come down to the facility level, and show you how to then attach that department and position together. So that way it shows up when you're building your security user. We'll jump back up to management console and talk about the password roles. Now the system again does come default set for you, but based off of your security guidelines, you're going to be able to make some changes to it. Length, complexity, even possibly set people up for self-service reset of their password if necessary. Kind of like you get from your bank. If you ever lock yourself out, you can have them send you a link and reset your password. So Point Click Care does give that option. It's not mandatory, but you'll see it when we get into the password rules. We'll talk about the security users, how I enter, how I disable. And so we'll talk about security user entry, and then attaching the appropriate role that might fit them, as well as some standard roles we're going to talk about as well today. Those are kind of used more for onboarding. If you want to easily attach them to a standard role, they could log in immediately while you're still maybe working on updating and customizing some roles. but we do recommend all standard roles be attached based off of their position. We'll specifically talk about if you're going to be planning on using multi-factor authentication and or secure conversations. Anybody that would be wanting to get that enabled and you would be driving that as one of your security officers, there is a very particular IT system administrator standard role that would need to be attached to yourself. So that way you would have the configuration capabilities for those two other items. We'll see that on the session today as well. Anybody could see it on the recording in the future. We'll talk about an audit trail report near the end of the session that gives you the ability to run a report based off of a security user or possibly a resident to see who and all have been in that record, reading, deleting, updating, and you'll see all the different filter options you have there if you would ever need to run the audit trail report. We'll talk a little bit about CRM security today, everyone, as well. You're also using Document Manager, so we'll do a high-level review of those settings. And if I wanted to customize those under a particular position that has already been built, kind of show you the easiest way to do that, as well as the easiest way to do customization of the security roles that come automatically in the system. We'll talk about eligibility verification security, as well as a little bit of the collection module setup for security, why some users see a link where other users wouldn't. And it's all based off of specific security role related to collections. You know, my BOM security user is going to have a link where maybe my LPN or RN or any clinical staff member would not see this in the security user area because they wouldn't need access to the collection module. So we're going to cover a lot of information today, everybody. And like I said, if you have a question, please feel free to put that in the chat message and, you know, we'll hit that as they come up. I already have that on a standalone screen, making sure I keep my eyes noticed on that one as well. Okay, so those are the main areas that we're going to talk about. And then one last item, and we'll hit that a little bit earlier in the training about IP address masking and making sure, you know, when your live database does become enabled and they give you access to that, getting those IP address in there as quick as possible to make sure that we make the system as secure as possible. Only allowing certain users to be able to remote access my database. Administrators, director of nursing, IT department members that may need to be able to sign in remotely. You'll have full access when you're entering a security user as to who can be a remote user and those that would not be a remote user. Okay, so every time we get to the let's get started section, everybody, that is when I'm going to now navigate over into my training database. So give me 1 second while I stop sharing and reshare another screen for you. And I'm actually going to log out of the training database for a moment here, everyone, because a lot of my clients, you know, their IT departments will have a link put on their desktop to make it a little bit access easier. But if not, the easiest thing you can do is, you know, use any of the search engines. And when you come out here, if you just type in Point Click Care, all one word, you'll notice it comes up with Point Click Care, best healthcare software. If I click that link, up in the top right corner is going to be a customer login. Once you click that link, I recommend saving this as one of your favorites if you don't install that link onto one of the, or on any of the computers. This is the area that you're going to be logging into to access your Point Click Care database. Excuse me. We are using my training database, and that's why I said during that disclaimer that there will not be any protected health information made available because everything in here is made up. So in your live database, when that is given to you, and you'll always hear your project managers, consultants refer to what your org code or organizational code is. Your live database is going to be that FNDJ or G, sorry about that, RP. So that organization code is everything to the left of that period. And then comes your period and then your username. So in your training database, you have that train PCC3 dot, and then I'll show you some of the default users that are already in here that you can use until you decide to create some additional users. Then you're just going to go ahead and enter in your password, and that'll log you into what we call our home page of Point Click Care. It always lands here because there's two important things that you're going to see. One is the top part, which is your facility bulletin board. And you can use that for any internal postings. You know, if there's nurses meetings coming up, if there's a big luncheon coming up, we always do recommend, you know, don't put any protected health information out there in case you have some external users, maybe a doctor or nurse practitioner that may not be part of your organization, but you give them access to Point Click Care. Show you how that's done as well today. But as long as there's no protected health information for anybody that is outside of the organization to see there is what we recommend coming on there. And based off your security, you know, you may be able to read it. You may be able to add messages, and that'll be what we talk about with those security roles today. But just by clicking the new button, I can enter in any note that I would want to put out there for anyone. I can tell it to display for only a certain period of time. I can make it bold, italics, you know, and I can remove the format, do any type of coloring. You can link on here as well. So if you have an external document that you want people to be able to read, you can embed the link right there on there so they can read it right from the bulletin board. So it does give you a lot of flexibility of making sure that everybody sees those that would have access to it. And again, every time they log in, they are always landing here. And again, it'll be there until that date to be displayed is hidden. So first part is all about your community, facility bulletin board. The second area down below, you'll also notice if that message does expire, you can click it and it would appear the older messages as well if they did time out. The second part of your home tab comes to the Point Click Care. Yes, there is a corporate level. I was going to get to that to where you can put it across all the boards at one time, and we'll see that at Management Console, but absolutely great question already. Once we jump up the Management Console, I'll show you that as well. But the next part is the Point Click Care announcements, and you'll see 3 different color codes down here, everyone. You will see a green, an orange, and a red. A green, I always say, think about those more as an informational item that Point Click Care is passing on to you. Could be our newsletter, could be links to Zooms or webinar meetings, information we want you to know about. There'll be things for like CMS updates. They also put them under the resource hub that I'm going to take you to as well today. So green is more informational. Orange, again, it's a software system. Sometimes we have to take pieces of it offline to do an update. So that's what the orange banner bar will talk about is small localized outages. Maybe we have to take Document Manager or the POC system offline for a little bit to do a system update. The notification will be out there with an orange banner bar. And then the big one is when we do a full system update, there is a red banner bar and it will display the dates and times, you know, all the different time zone, Eastern, Central, Mountain, Pacific, all the time zones will be displayed there as to when that system would be taken offline for us to perform that update. It's usually out there about a week and a half to 2 weeks before the outage is going to occur. So everybody's well aware when it's going to come on. So the reason it lands at the home page, everybody, is we want you to review it, not only your facility information, but the information that Point Click Care is going to send along as well. And to answer the question that is in the chat message is up here in the top right, we're going to jump over to our Management Console for the first time. And up here, you get that same bulletin board. When I click New this time, this is how I can tell it where I want it to be shown. So if I scope something corporately, everybody, it goes across all the facilities. Maybe if I'm only, relative to my skilled nursing or assisted or independent living, the scopings are all built in here the same, everyone. I can have it show only across the databases that are considered skilled nursing compared to IL, AL, so on. Or I can do it based off of each separate database at Management Console. So if I'm an EMC user, instead of jumping around to each location, I can do them one after the other and list it specifically to the building that I wanted to as well. So you do have that capability for those that will actually have Management Console access. Okay. So I know that's under the Foundation Group Training Room title, so I'm not sure who asked that question, but like I said, good question to start off. The next thing I always want to point out is, again, it's a new software system. Where can I do a little bit of research? Because again, you're going to have the recordings. We're going to talk about your access to your smart zone up under your home tab on the top left. Everybody, you've been notified by the project managers that you'll get access to a smart zone. And if you use Relias, they can combine those. Smart zone's nice. I can watch small versions of recordings. Some of those are called e-courses. Some of them may be user-driven to where I click and follow through the steps. Some may just be me sitting back watching the steps be performed. So Smart Zone is going to be ideal because they'll chunk them down into about 15-minute, 30 minutes. I think the longest recording one I saw out there was maybe an hour. So they are nice bite-sized bits. But in your main database, when you get access to that, you'll be able to review all your Smart Zone information is out there. But the other location I always want everybody to remember is this question mark. It's called the Point Click Care Resource Hub. If I click on here, you'll notice it has a red dot because there's been some things that I haven't taken the time to read yet. And those are under my news and updates, whether they're project, regulatory, or any Point Click Care announcements as well. If I click on that, you'll get the list of information that Point Click Care is sharing with you as well. So if I continue to scroll down through this, you're going to notice that once I get to a red dot and I start reading through it, you'll watch it phase out now that I've read. Not that I clicked on the link and reviewed it, but I've at least seen the subject. So again, always keep an eye out here for any news and updates, whether it be product, regulatory, or any additional Point Click Care announcements. So this resource hub is one of the first locations for some additional information as well. The next is called your customer support portal. Now, in my training databases, I get a single sign-on error. It doesn't open up. But when you look in your live database, when you first click on that, you're going to be able to go in and search for answers. You're going to be able to open a Point Click Care support ticket if need be. And we'll kind of cover that as we continue going on through. But starting off, you're always going to be reaching out to the consultants with questions until you get through your full implementation process. Customer support is great for answers, opening cases, and one of the ways to get into our help section as well. The Guide Me Interactive Assistant is a great tool that is continuing to be built in different sections of Point Click Care. So like right now, I'm at the Management Console and I'm at the Home tab. But I tell every client that I teach, periodically when you're on a page, click this Interactive Assistant. So notice right now it just says, oh, do I need to change my password? Because it's not fully functional across the entire database just yet. They're continuing to build things every week. But if I just jump you up to what is called our CRM module, which we're going to be doing training on later this week, this is our customer relationship management module, and this is where we track our referrals. But if I go back to that same resource hub and back into this Guide Me option, You notice there's a lot more items that just became available than changing my password, because the CRM module was the first module within Point Click Care to go fully functional with this interactive assistant. And when I first saw it, it's a game changer for any client when they're learning this system. Because if I'm working in the database and I click on that guide, it's going to say, okay, well, you're at this screen. There's certain things I can help you with. And if I say, okay, well, how do I add a lead resident, which I'm going to teach you on Wednesday, it's actually going to bring you up. And every time you click where that item points you to, you're going to enter that item. And when you're done following those steps, you've completed that task. Okay. But like I tell everybody, it's not fully functional across the entire database yet, but it never hurts when you're on a screen. Pop in there, see what it says. Because now notice my options have changed because of the screen I'm on. So it is a great item out there when you're just being introduced to Point Click Care. The Train Me. Think about this as a way to look at the courses that are out in SmartZone. So you're going to see some that are called e-courses and some that are called live. Live are instructor-led. Those are the ones that trainers like myself, we hold monthly additional training sessions for any of the clients of Point Click Care to sign up for and take over a broad range of items. So you can come out here, use it either way. But the e-courses are those ones that are going to be, watching the video, maybe interacting with it, where the live versions are actually instructor led, and we will hold about an hour and a half to 2 hour session on that topic. But you'll notice they also have it broken out into just the instructor-led training. So if I didn't want to see all those additional e-courses and I really wanted to sign up for what we now call virtual VILTs, virtual instructor-led trainings, I can access and only look at those or even search for the item itself. So if I type in, like we're talking about today, everybody, security, you could always take that session later in the future with another trainer that would do the same security setup and management. So please always remember that little question mark, because it is just a wealth of information out here. It also gives you the ability to join what is called our online community, or AKA called the Pulse. This is my training database. I do not have security access to it, but we'll talk about that on how you grant that through specific email addresses in the security users. But the online community, also known as our Pulse, is where our clients can communicate back and forth to one another, ask questions. If you're out there reading something and you know the answer, you can give them the answer. Hey, this is what we did when we first were on Point Click Care and we started using the system. So it's just an additional arm of training. I've seen clients out there teaching other people best practices. Hey, this is what we did all the time. Seems to work for us. Don't be afraid if you have your email address in there and access to the online community to go out there and join it. And then you'll also have a link to what is called our Help Me, which is our internal database of files. So I can access it through this link, or I always teach everybody kind of a little cheat here real quick, but I'll take you through this access point first. It's going to ask you, how can I help you? I can search for an answer, or if I kind of know the module that I'm working in or have questions, I can click on that. And again, I'm a financial trainer, so I'm going to say on the admin side. And then it breaks it down into each topic alphabetically. So if I was working on something, and we're going to use today, everybody, as our example, security. Then it gives me a sub list of security items. Oh, well, okay, I'm working on security users. How do I create a security user, or how do I assign standard roles? You can click on any of the links. When you get into this section of our help me files, this is where you get the good step-by-step, follow the clicks, and it leads you through the system to what you want to do. Okay. Very detailed on some pages. Some, may just say complete applicable fields because, not every field may be entered in. This is the good area where it comes with the very detailed information. Follow the clicks. It'll lead you to your steps. Okay. So that's one way of getting there through the resource hub. But what I always teach everybody to try is press the F1 key on your keyboard. A lot of times it'll either adjust your volume. I've had a couple clients that happen to, so I always try them use the function key F1 and normally it gets them here. But most that I work with, by just pressing F1, jumps me into that same help section. So multiple ways of getting there, everyone. But this to me is always the most convenient if the F1 does work for you. And again, like I said, it is just a ton of information. Each page can be printed if you were creating a guide for some other employees, but it does break it down into all of the main modules of Point Click Care as well. Okay. So I'm going to leave that page because we weren't technically making an update. I just wanted to show you some of that interactive assistant, which please everybody, I know I'll repeat this a lot throughout training. Keep an eye on it because new areas get added in left and right. Okay. So first thing when it comes to security is my departments and my staff positions. Again, being a multi-facility database, you're going to have what's called your enterprise management console that we took you up to when we were talking about your bulletin board. But everything financial when it comes to setting up your users is on the financial side. So that's why the financial trainers walk through this part of these sessions. So over on this tab called standards, if you have the security access, you'll be able to get to financial management. And up on the fourth link down is called your pick list. And there's only 2 items that we're going to look at this section today. There are other things that in future training sessions and your configuration, you'll be taught to update and make these your own. Again, Point Click Care is extremely customizable, but you are the one that customizes it because you know what you want. So the first thing we look at is what are called your departments. The one thing the department does is it tells the computer whether the person should have access to a care plan. Now you'll notice some do, some do not. Again, I was a business office manager. I was on the administration side of the company. I couldn't tell you what a care plan looked like. But if my department needs it, this is where I have to give them that access so the department has access to a care plan. And, these all come defaulted with the majority of the departments that most clients have. But again, every client, may phrase things slightly different. So you can see in my database, I have nursing and I have wellness. Well, a lot of assisted livings call them a wellness department, where SNF calls them nursing. So there's usually for multi-community databases, both of them out there. But if I'm building or needing to build a department for just one that is not listed in Point Click Care because it's not in our master database, is I can easily click this new button, call the department what I want to, and you can see I did this training a little bit earlier today. So I called it test new department. This one I'll just call test number 2. And for training purposes, I always put an asterisk in front of them so it shows up first in alphabetical order. This is where I'm going to allow them to have access to that care plan if they need it. And then I have the ability to scope it corporately, just like we talked about on the dashboard. Maybe this department is only used at a skilled nursing facility, or if I'm in multi-states, maybe only, I'm from Pennsylvania. Maybe only the buildings in Pennsylvania have this department name. you can get as detailed as possible, or maybe it is just a particular facility. So maybe I'm activating this department for only my assisted living community, and hit save. Now, when I do that, and notice because I did make it specific to only one location, it shows up in yellow. So everything that is scoped corporately could be available in every database. That's best practice, everyone, and I'm actually going to flip this to be the same corporate level option, even though that maybe not all my buildings use it. But anything would be in green would be either updated by this second line to be line of business specific, again, your skilled nursing, assisted living, or independent, or if I updated it by a state. I'm going to flip that back to corporate because even though I created this item, maybe only 2 of my 40 buildings actually use that term, but maybe it could roll out in the future to other locations. You're going to notice when you're at management console level, when I built this, it created a facility link next to it. Now I can activate it in any one, all, or just whichever number of communities it needs to be activated into. I'm just going to make it available for just my skilled nursing side. So even though I may call it corporate, I tell it where it's going to be made available. So I have full control over that based off these facility links. Okay. I'm going to go ahead and hit the back button here, everyone. I do try to advise everybody, be careful of hitting your back arrow of your browser. Periodically, might log you out of point-click care. Daryl, if you have, depending on the organization, if they had been provided to the consultant, most departments all come preloaded with, all databases come with those major ones that you see there. But if you have any specific ones and that was given to the consultants, they can have those created for you as well. If not, as you clearly see, very, very easy process to go ahead and create. But normally, depending on your thing, all of these do come, the normal ones, but if there are any specialized departments that, not a lot of people use that terminology, you may have to create a handful if it wasn't given to the consultant. Okay. Next up, I'm going to scroll down just a little bit and then go into the staff positions. This one's going to be a little bit longer. And again, this is the one where there could be a little bit of customization because I do know across all the states that I've worked in and all the states that I've trained, everybody calls staff positions things slightly different. So again, ours comes with the predominantly well-known across the healthcare field. And again, you saw down here at the bottom, there was a yellow one that was only made available to a specific facility for a reason. But up here, it goes alphabetically by all of your typical ones that I see. But again, everybody might call something different. So maybe we have, a certified medication aid, but we don't use the word tech at the end. Well, I could edit that and just remove the word tech if it's not something you use. Or I can create any new staff position if it's not there. So again, just like your departments, and you saw I'm using the same training database from earlier, test number 2. Again, we want to give it, not that it's mandatory, but the short description, kind of think BOM, Business Office Manager, DON, Director of Nursing, MDS. That's what that short acronym will be for in here. Order, if I leave it blank, it'll show in pure alphabetical order, but from drop-down menus, if I make a 1, it'll show up higher than a 10. That's all the order would do. And then most clients will have an average care shift hour of 7 due to the breaks and lunch. So we can go ahead again, same scoping options that I have here available as well. I'm just going to hit save to enter that in. And then again, just like my department, what locations do I want this to be made available in? So maybe this position is only available in my 2 skilled nursing databases. The assisted living does not use this term. So again, I scoped it corporately to make it available for everybody, but I activate for only the communities that I want it to be seen in. And hit save. Okay. Now, the next step can only be done at each community level. So at each database, we do what we call bringing the departments and positions together. Okay. So at that point, I'm going to go down from enterprise management into whichever databases that I have security access to, which when we finally get to the security users, I'll show you how you give them the appropriate access to the locations that you need them to have. Excuse me. So I'm going to click on my Nursing Advantage database, and it's going to slowly update here. And then I'm going to go into the 5th link at the community, facility, or database level. And I'm going to go into that link called department/positions. And you'll notice in the middle, I have 2 unassigned. And one of them is the brand new staff number 2 position that I just created. Far right-hand side is an easy way to review where each of these are already been set. Now I can review that list over here, or if I want to see what is all under activities, I can see, oh, my activities has 2 positions, activity director versus aide. Notice, maybe you use the term activities/rec therapy. Well, if I created that and need it to be under that appropriate department, just place a check mark, hit save. Now that is connected for my one community, the Nursing Home Advantage, but not the clinical standard database and not the AL, because each database has to be touched, bringing them together. Or, maybe I'm looking at my nursing department and we don't have CRMAs in my state, right? So if I don't want that to be part of a drop down when I'm building a security user, I can take the check mark out, click save, and now no one sees it because it's not attached to a department when we're building security users. But, our main thing was I created test staff number 2 to go in department number 2. So easily connect and disconnect. So when we finally get to security users, you'll only see the staff positions that are relative to this location. Okay. Any questions up to that point, everyone, between a department, what access that gives you, again, the care plans, the staff position, again, can all be done at Management Console and easily connected to any database that I want that done through that facility link. And then how at each location level, I can bring the 2 together or flat out tell it, hey, we don't use that position here. It's not something I need to see, but my other communities might use it. So I don't delete it in case others do use it. I just unattach it. It's no longer available in this database to be selected. Okay. We're going to jump back up to Management Console. I'm going to take a guess that your password rules organizational wide, correct, everybody? So up here, we're going to go back to Management Console, hover over Standards, go to Financial Management. Now we're going to scroll down until we finally get to a blue bar that talks about security. Now, I don't go in the order that they show up, everybody, because there's items that we teach in a certain way. So the first thing I'm going to show you is your password rules. This is where I make the password rules for the entire organization. Now, it'll come default set to normally this. And based off of your security protocol, you can make changes to a certain limit. The first limit is minimum length. I cannot go any shorter than 8 characters in point-click care. But I can go as long as 64 characters. So you can set your minimum length versus maximum length, but you can't go any shorter than 8. Complexity, completely up to you. Do I require capital letters, a number, a non-alphanumeric character? We always recommend, at least for this one, you can set these as what you want, but we don't ever recommend as best practice that they can enter the same password over and over. But again, it's your database, you set it up to your complexities. You can set from 1 day to 365, and again, or the password never expires, which again, when you first see our training database, basically it's set to the best practice in healthcare, 10, 15, and 90. But again, can be customized to match your security protocol. Max failed logins. What that means is, let's say that I'm trying to log into my database today. I seem to have forgotten my password, and once I log in 5 times, it'll lock me out and not let me try it again for 5 minutes. So that drives me. IP address failed logins. Think about that as being a cumulative count at that IP address. So within that 5 minutes, if I have 20 failed attempts, it'll lock everybody out for 5 minutes. So what I see a lot of people do is kind of beginning set it to 40. Normally you don't have that many failed logins all at the same time from the same IP address, kind of people pinging for that 5-minute time frame. But if it would hit that 40 mark, then it would lock all users out for 5 minutes, and then it would release it to allow anybody to be able to log in after that. I've seen most people set to 40. A few have gone to 50. We do not recommend disable IP check. It's okay. You're going to be able to put in any and all IP addresses. We're going to get to that under the IP address masking. So if they have a series, we'll be talking about that here shortly, Derek. But they don't have to have a static. Okay. This is that enable password service reset that I talked about. All it is you just read the authorization that you're allowing for those password resets. And then as long as that person has an email address in their security user file, they would receive a link to reset their password. If it's not something you're interested in, it is always there, but you never, you could change it years from now if you felt like it. Any change that you would make to these roles do not affect any current user. It'll only affect them once their password expires and they have to reset it anyway. Okay. Again, I'm just going to go ahead and cancel mine, not make any changes at this point, but that's where you're going to run your security rules. Okay. Now, to Derek's question, You have multiple locations you can do this in. One is at Management Console. So I have what's called IP address masking. I can do facility and set their IP address. If they have one, I can put it in. If they have multiple IP addresses that, depending on how the segment is, the first three segments are the same, but maybe the last three characters change. Well, I can use asterisks in that place. And Point-Click-Care calls them a wildcard, and it'll ping off the first three segments. But as long as, the first three are correct, the last three can be a little different if they have multiple IP addresses, or I can stick them in, if they only have three, stick each one on their separate lines and validate it. Now, the other thing I can do is what's called a bulk update. So I've had a couple clients where, people sign in through, this VPN type thing. So technically that IP address is the same for like the majority of their communities. Well, you can do a bulk address update too. So if these communities use the same IP address, I can link it there, save it, and it updates all three locations, or maybe only two at the same time. So, depending on what their IP address is in, we just want to make sure they get in the proper way. So, Derek, does that answer your question? Thank you, sir. Now, I can enter it here, or maybe, somebody's on vacation, I'm covering for them. I don't have Management Console access, but I have access to single facility that needs something added. Well, that's all found under the same admin setup area that we're going to talk about periodically throughout these training sessions. But it's actually under the second link called facility configuration. And if I would have entered those numbers up at Management Console, they would appear here, or I can enter them single lines and validate them as well from this location. At each facility level, you also have the ability to set the system to do a session timeout. So if somebody would walk away from their computer, I know we train everybody, hey, if you're leaving your workstation, log out of your computer so nobody's entering data in under your name. I can set it from anywhere from 5 to 2 hours. Shortest that we recommend is probably 30 minutes, because if somebody's in there typing up a nursing note until they would hit save, it doesn't technically see the keystroke as them being active until they hit the save button. So a lot of the clinical trainers will say, don't go anything under 30, because let's say they're in the middle of a note, call bell or something happens, they run, they forget to log out, they could time out before they get a chance to save the rest of that note. But, it always defaults to an hour, everybody, but you can set that. I've actually worked with a lot of clients that they're like, Rick, our system is preset to log them, at least lock their terminal well before your 1 hour session. Is that a problem? No, because you can lock the workstation. Point-Click-Care will still be up and active for the hour, but the workstation's kind of locked. So either of the IP addresses can be done either the way. If you don't have Management Console, it can be done through that box as well. I'm going to hop back up to Management Console, back up to Standards Financial Management. Okay. Now, we're going to talk a little bit about multi-factor authentication again, but there's a standard role that has to be assigned to the person that's going to enable or run the configuration of this. So before I jump into there, I want to take you a quick look into what is called your security users. I'm not going to spend a lot of time there at this point, but we'll hit it heavy here a little bit further on. But I'll use myself as an example. I can search for my users. I can go in and I'll teach you how to enter them, but I'm going to edit this one. And you're going to notice under this standard role, and you heard me talk about it for multi-factor authentication and secure conversations. For that person to enable as well as configure the functionality, they have to have this standard role of called an IT system administrator. So for any on the team that is going to be doing that, make sure under your username that IT system administrator role has been attached to yourself. I'll show you how you can do it here, but you can also do it under standard assignments as well. So there's multiple ways of doing this if there's a number of people that need this same option here. But if I did not have that standard security role, I would not be able to do anything under this multi-factor authentication. Okay. One, you just have to have the user download the version that you're going to use. And then you're going to go into multi-factor. Again, enter in your username again. And your password. And I did get an error with this one this morning, and I can turn it on and accept it. Now, with this, you have full control over, which users might use the MFA. Is it only for system administrators? Do I want to activate it for system administrators and remote users that have the appropriate selected standard role to do so? Do I want to activate it for the system administrator? Again, your IT, notice you're always involved with this, but maybe it's not just a remote user. Maybe I want an internal user, an RN, LPN, CNA, to have to receive a multi-factor authentication. So you're going to control that all through here. And then how often do you want that to be done? And then once you would make whatever change you would like, notice here it says, oh, okay, well, if I change it to remote users, but also those with a specific standard role, what roles would I want that person to be able to do? Now, I don't make any changes here. That way it doesn't affect anybody that might use my training database in the future. But if I only wanted, a certified nursing assistant to get a MFA, I can add it here and you're going to notice it's listing out everything. And then once you accept it, when you hit save, it'll fill in all of this information off of the person that's doing it. I just don't hit save here for training purposes, everybody, but you control who, again, not mandatory, but if you wanted to use the multi-factor authentication option in Point Click Care, you have that capability as well. Okay. So we're going to go into security users. Now, if I'm working at Management Console, which a lot of you probably will if you're going to be entering in new employees for other locations. If other locations are doing it and they only have access to it through their facility, it can be done there. Same screen, they just don't see what are called multiple or enterprise users unless that person is part of their security team and security user in their database. The one thing I always caution when you first see Point Click Care and you come up to the Management Console, you'll notice I currently only have 44 employees. Well, Management Console, I should be able to see everybody. Well, if I scroll back to that top and I go under this option called Access, you'll notice it kind of hides the people that are single facility users only, because they're like, well, you're at Management Console, you want to see the people that have access to one or more locations. If I put a check mark in front of single facility users, Now I've told the system, well, wait, I appreciate you kind of hiding people that you didn't think I wanted to see, but please show me every employee that is currently active in my database. So I can easily switch that back and forth. I can look at it based off of single, multi, or enterprise. It will always default to active everybody, but if somebody happens that they decide to leave, I'll show you how you disable them. But maybe a couple months later, they're like, grass wasn't greener over there. Could I come back? Well, when we disable them, we actually make them what is called inactive. And I'm going to kind of make it a little bit easier to find. They'll show up in red. And then I can easily edit and activate them or enable them all over again. They're right back with the same username, password, roles, and they're right back on in this system. So I'm going to teach you how to inactivate them first. And then you see there, oh, well, they left. Nope, they're coming back. I don't need to create a new user. I can just enable the one that we had in the system before. When it's time to create a new user, we're going to go ahead and click new. And then we're going to run through all the fields that you want to complete. Now you will notice in point click care, anything that is a mandatory field will have a red asterisk. Because maybe, this person could be a financial employee, so they don't need technically as much as a clinical user. So that's why a lot of these are optional. But in here, I'm just going to enter in their full name. So here, and I'll delete myself at the end of this. So if I hit tab, it jumps me over to the initials. Now, these are really only for the clinical side, everyone, because they can be a total of 4 characters. And they have to be unique. So if I have a lot of people that have the same initials, my twin brother is RD as well and has the same middle name, so that doesn't work. So I can use first, middle, last initial, and then I have the option of using 0 through 9 at the end of it to differentiate these people from one another. Because the initials do have to be unique. If you weren't aware and all of a sudden you try to save it and says the identifier is not unique, it means you repeated the initials for that user, somebody else hasn't. So again, really the only users that need to be entered in are those on the clinical staff who have access to point of care and the EMR. So if I'm putting a BOM in there, I don't need to put initials, but I know some people like to be consistent. Just know that, again, they have to be unique though. Okay, everyone. My user is non-clinical, so I'm just going to bypass that. Then I create their login name. So that's what I'm going to use to log into my database. Notice your organizational code, everybody, is hard set. That's where you're going to see your FN, DGRP, and then they'll enter in the, normally first initial full last name. External unique identifier. This does not pull to any reports or anything, everybody, but let's say I have 2 John Smiths. They're both RNs. I can put in like a payroll number or an internal number to differentiate those from one another. So when I know I'm looking at one person, I know it's this person over another. Again, not something that I see used a lot, but it gives you the capability. Secondary POC, we do not use. Physical ID code. This is really state dependent, everybody. And what I mean by that is most states do not require 2 forms of ID for electronic recording of medication administration. If you are in a state that does, then you may put in the other ID number. And I always tell everybody, I've worked in a number of states. Ohio was a big one where I kept seeing a nursing staff scanning a card all the time when they were doing certain things. And I finally had to ask, not being clinical, I was like, I don't see all the nurses do this. And she said, well, this is my second form of ID, which was coded in here. So in the state of Ohio, she logged in Point Click Care. And then when she did the medication passes, she scanned her badge, proving she was that same nurse. So if your state would happen to do that, that's where you put in that second identification code. So when they scan it, it knows who they are. It's kind of cool, but when you only see it periodically, it was kind of weird. Now, these are the emails, everybody, that we were talking about to give you access to Pulse. And then also, you'll notice there's two different emails. So the first one, if your employee has a normal email address, put it in. It's used for logging support cases. It'll auto-populate for them when they open that up. Again, if I did the resetting of passwords through that optional email, that would be there. The second email address, think about this communication as your key personnel, administrators, director of nursing, MDS, BOMs, key department heads, because the communication email, you'll become part of an email notification from Point Click Care that if there's server slowdowns or issues or delays, you become part of that communication email. So that's why we say key personnel would go into the communication. You don't want to put that for everyone because, a lot of the CNAs or LPNs or RNs may not need to know that, but my key personnel would. Okay. DigiPass, not something an admin person would use, but if you're using Secure Conversations, and if you are, your clinical trainer is going to talk to you more about this, is if there's anything that comes with those security feathers for your medical professionals or employees, the DigiPass serial number is what you would enter in there to be able to have that, know who they are. First name and surname. I highly recommend always put the person's full first and last name there in case in the future you get to some of the additional single sign-on items that Point Click Care offers, integrated claim management, things like that. Some of those single sign-ons will be looking at this field, the first and surname, and if it doesn't see it, you'll get an error during some of those. So I always recommend always put their first and last name over here. Even though it's not required, it just makes your life easier in the future. Designation, I'm going to skip for a second and kind of circle back to it after I talk about that staff position. So this is that staff position that we had talked about earlier. Their department gives them access to the care plan. Their staff position gives them access to our standard dashboards. Now, later in training, you're going to be shown how you can create your own custom standard dashboards for specific roles. So this position drives the dashboard that they see that you're going to see here in a little bit as well. But let's say, and you'll see my test staff number 2 that we created earlier came up. But we're going to say that actually I am an administrator. Now, if I leave it set this way, if I do an electronic signature, it's going to print my name and the word administrator after it. Or think about it for like your DONs, your LPNs, your RNs. A lot of them have credentials when they sign. So I know in Pennsylvania, when a lot of my nursing home administrators would sign off on something, they always wrote their name, comma, NHA. Well, in this designation field, whatever I enter here will show on their electronic signature. It will override their staff position. So if you think sometimes, you have the DON, comma, BSN, comma, RN, whatever their credentials are, you can enter that into the designation field, and that will print after their signature, not their staff position. You'll notice each of these kind of have a little information icon. So you can see you have to put a position in so they can get the smart zone. Standard role mapping, talks about here must be completed to use the pulse. So as I was talking about, when I clicked on the pulse and it said that I didn't have the security access, if I enter an email address in there, that gives me access to the pulse. Standard roles, kind of showed you that one real quick here as we were going through about the multi-factor authentication, but notice there are set standard roles based off of their positions. So we always recommend, give them the standard role that makes sense. We call it more of an onboarding item. And so in case you're working on configuring and building some of those additional custom roles, I can quickly give them the default access that Point Click Care has set up, a standard role. But if my administrator also needed to be able to maybe configure secure conversations or multi-factor authentication, I can link more than one. But they'll be based off their names. Always, when you're setting them up, give them just a temporary password. When your security users are imported, everybody, they always do welcome #11 with a capital W. You'll see that at the PowerPoint presentation as well, when we give you some takeaway items if you want to test them out and play around in your training database. But we always use welcome #11 with a capital W. But we also say that they must change the password on first login. So that way they then make it their own, but they meet your credentials that you require. If they are using POC, you can set up an alternate PIN or password. So if my normal login is 12 characters, but if they're going out to the point of care kiosk, you can set up a shorter POC password, kind of like I always refer to it like an ATM PIN. Make it a little bit easier for them to log in with those ones. But I've had clients are like, nope, we use one password. They use it across the entire system. That is fine too. I recommend leave this defaulted, because as each user starts to use Point Click Care, and I'll show you at the end of the call, how they can go in and set the system to say, okay, well, if I click on the word admin, I want to go look at a resident list, not a dashboard. Whereas if I click on the resident name, I want to go to this tab all the time and not a different tab. Each user, if you give them that capability, can configure the system, again, certain points of where they prefer to land when they click on some of these headers that I'm going to show you. Auto page setup, please make sure that is always checked. That makes sure that all reports print properly and without issue. This is the box that would make them a remote user. So that way, the IP address masking that we talked about earlier wouldn't contain them. They can sign in from any IP address masking. Now, there is some geofencing set up. I don't have a list of all the countries, but there are certain countries that they don't let you sign in from based off the IP address. But again, there's always informational icons here. Here you can see talking about multi-factor authentication, and it would take you to our help section to even learn more about it. If they need access to all facilities, I can make them an enterprise, and that means just like my database, I have enterprise and all the facilities in my list. If not, and maybe they're only working at a couple locations, I can set their default, which I'll make this one Nursing Home Advantage for the time being, but maybe they're going to help out at another location. I'll show you how you can give them access to an additional database in the future as well. And then again, This is where I recommend going in and disabling somebody, because I'm going to show it to you under the action link as well. But when you enter the employee and then you edit them, disables here, and there's a delete button way at the bottom. So it's kind of hard to mess the two up. We're going to leave that one active for now. Max failed logins. Again, I always leave it go to the system default because it pulls back to your password rules. Single sign-in only. If you would opt to do that, you'd be working with another department inside of Point Click Care to enable the single sign-on for your entire community. That would be the only time you would come in and do that. You don't want to do that starting off unless you work with our vendor integration services to test and sync those single sign-ons together. Valid until. Nice feature for if I hire a temporary person. Maybe I have a college kid home from school. He's going to work for maybe 2 months. I can put the valid until, and then the system will disable them for you. If I'm building this for one of my medical professionals, a doctor, a nurse practitioner, dentist, whomever that doctor is linked to, when you see how to link them to the resident chart, I will then give them access to only their residents. So they wouldn't see all residents, they would see the ones that they are associated to. Same thing with an external facility. Maybe I have a pharmacist that works at ABC Pharmacy, and I want to have them be able to see the list of their residents and access and read areas, but I only want it for the residents that use ABC Pharmacy. I can link those together that way as well. I get that question a lot. The question is the valid until used for surveyors, or will they have a separate way to log in temporarily? You could actually, and normally our databases come with a surveyor security username already created for you. And you can set that to an end date if you want. And I always joke around that, set it for tomorrow. So if they come back in, they have to ask you to reset their password. But definitely, again, even the default one is just a security username. They don't do a valid until for those because they don't know, if they're only going to be there for 2-3 days. But there is always a surveyor in there. And again, I've seen some clients, because maybe they get a team coming in and each surveyor needs to do that. I've seen one with surveyor 1, surveyor 2, surveyor 3, depending on, how many surveyors they sometimes getting in there. But you can create just basically a name called surveyor, and then you can use that same one over and over. When this team leaves, disable it. When the next team comes in, enable it, reset a password. That person can just use the surveyor name over and over. And there is actually already a surveyor role that is already set up for read access only. Now, that is correct, Daryl. They would have to be inside and linked to your IP address if you do not activate the remote user. Absolutely correct. Now, if I hit save and next, it's going to take me to a listing of roles. But until I talk to you about what these roles consist of and how much control you have over them and how you customize them, I'm just going to hit the word cancel for right now, because that's on a different screen. I like to focus in on that once I clear you off of the security users. Now, anytime I create a new user, just make sure you refresh the screen, everybody, because until I refresh that screen, I actually wouldn't see the new name that I just created. So you can see I just did a quick search. I brought up my name, and here's my action link. Now, if I was the administrator, and remember I gave myself access to only the one location, but maybe something happens under that access link, maybe the administrator from my other location is going to be gone on vacation for a week. And I'm going to help cover their location. I can quickly add that facility to be part of my drop-down menu. And then when that administrator returns and they no longer need access to that database, I can remove it just that quick. So that controls for somebody that's not an enterprise, which means they get access to all facilities that we saw earlier. That access controls which of these databases they're going to be able to see. Then you'll notice here's your delete and disable. So remember I said I prefer to do it through the edit link so I don't make the mistake of clicking this by mistake instead of disable. Either way you want to do it is completely up to you. I just think it's safer under here because it's a little hard to make the mistake of disable versus delete through here, where the action link, not that much gray area between those links, everybody. But either way works. Only time we recommend that anybody be deleted is maybe I believed a new hire is going to start tomorrow. So I'm in there getting them activated for today, waiting for their first day on the job tomorrow. Find out they decided not to take the position, then I could delete the user. But if they've documented in there, we don't recommend deleting. And again, even if they've been with me for 5, 6, 10 years, they might think the grass is greener somewhere else. They leave, find out it isn't. I can enable them very quickly, like I showed you earlier. So, if I do disable that person, you'll notice they do disappear. I change it back to inactive. Hey, you tried it at another location, missed the company. I can enable them whether it's a week or a year later, however long, and now they're back in with all the same security rights that they used to have. And under my security roles, this is where it would show what they have. In this case, the administrator would have been there, but I didn't attach it because I want to show you the detailed security roles before we get into that discussion. Yeah, we're going to look at that audit trail report a little bit later. Up under the top right-hand side, you have a couple reports here. One is called the role detail report. To me, this becomes especially useful for new clients. Let's say that you already have in a number of different users and they're under different roles. And you hire somebody and they're like, hey, they need the same access as, so-and-so. And let me just pick this because right now it's only showing those 3 people. Let me research that and run it again. So if I have an employee in there that I know I've done some customization to, or they're using the system, they have all of the access that they need. This role detail report will show you what they are currently under. And so if I hire the next person and I'm entering them in, I can basically use this as a guide to enable each of the appropriate roles or one main custom role that I'm going to teach you here shortly. This way I know, oh, Jim has that same access. Let's give it to Barb who just got started. And I know it's going to work because it's based off the same security roles that Jim had. I can look at it on that, printout, or I can export it into an Excel format and then do some, data filters and sorts. But I love Excel and never been a big fan of this report in Excel because until you do the data sorters and filters and sorts, you're going to notice that for anything that was blank on my last report, Excel throws the word false in there. So until you set that up with the data sort, it's sometimes hard to find where I was able to easily detect the word trues where the other report was just a blank field. But either way will show you exactly what you want and what each of those people are assigned to. User list report comes in helpful for reviewing. Do I have all of the appropriate employees that should be remote users? Did I forget to auto page set up somebody? And then I can see the positions that they're activated and listed under as well. Login history is exactly that. Now, this is my training database, so nobody else has been in it. But one thing I always recommend, uncheck include only current sessions, because if somebody logged in today but then logged out, I still want to see that they logged into my system. Hit run report. It's going to list all the times that that person has logged into my system, IP address they're doing it from. Yes, even your trainer, everybody, and I apologize, sometimes put in the wrong username and password. But it's going to show you all the times people were logging in. Okay. And then a nice report is this inactive user report. Now, again, I can run this at the facility level. I can run it at management console, but I can run it for any period of time. Again, I can export it to Excel and get a list of employees that are still active in the system that just haven't logged in. If they haven't logged in, I can always follow up with the team. Hey, is that person still work there? If not, they haven't logged in for X number of days, and inactivate them if necessary. So the inactive user report, again, at Management Console can be found right there. Facility level, you can run it through the Report tab at the top as well. And so go back down to financial management. And before I get into security roles, again, the session is set to go for a full 3 hours, but I never make anybody stay on for a full 3-hour Zoom meeting. Transitioning from security users if there are no further questions, but I don't know who asked the question about the audit trail report. We're going to kind of look at that one a little bit later. So I'm going to cover that one in a later part of the session today, if that's okay. But this is an ideal situation from talking about security users to transitioning over to security roles to see if everybody is, needs to take a break. With the 3-hour session, I always throw out the option for a 5 or 10 minute break. I let the team decide what they think is best for their team. And then I'll pause the recording if they decide to take a break. So I see Foundation Group Training Room saying break is fine. Does everybody need 5 minutes or 10 minutes? 10? Okay. I'm going to go ahead and pause the recording then. It's currently 2:26 Eastern. I don't know if you're all in the Eastern time zone or some maybe in Central. I'll pause the recording. Go ahead and take a break. It just flipped to 2:27, so we'll pick this up around 2:37 Eastern and then convert that to your time zone if you are in a different area. But I'll talk to y'all in 10. I'll bring that back to the Zoom meeting. So that way, when we get back, we're all ready to go. Thanks, everyone. Okay. Hopefully everyone's back. I'll go ahead and turn the recording back on if that's okay.